Heart attack, which stands out as the most common cause of death worldwide, is more common especially in cold weather. According to experts, cold and windy weather has a negative effect on the cardiovascular system. Especially in people with arterial occlusion that does not show clinical symptoms, cold weather can trigger a heart attack by further narrowing the blocked artery, increasing blood pressure and increasing heart rate. For this reason, it is especially important for people with risk factors for cardiovascular diseases to pay attention to their living habits in cold weather. On the other hand, it is stated that heart attacks, which were previously known to be common in men, have started to be seen more frequently in women in recent years. The most common causes of heart attack include risk factors such as diabetes, high cholesterol, fatty liver, smoking, insulin resistance, obesity, sedentary lifestyle and alcoholism. Especially in recent years, thanks to the increasing food orders via smartphones and the internet, the habit of eating fast food has become widespread, and the abandonment of traditional vegetable dishes has increased the incidence of cardiovascular diseases. When it comes to fast food, most people only think of hamburgers, fries, cheeseburgers, pizza and cola products. However, all foods that are rich in carbohydrates, have a high glycemic index and contain saturated fat fall into the fast food category. Simply put, today's average sandwich made between white bread contains more saturated fat and refined carbohydrates than a hamburger. Such rapidly consumed foods can cause diabetes, high cholesterol and triglyceride levels and weight gain, leading to cardiovascular diseases both directly and indirectly, which can lead to sudden deaths. On the other hand, despite the necessary information about smoking, there are still people who persistently and stubbornly do not quit their smoking habit. In smokers, oxygen to the heart decreases, blood pressure, heart rate and blood clotting increase. Therefore, the first risk factor that must be eliminated in reducing and preventing cardiovascular diseases is smoking. Acute or chronic alcoholism also poses a significant risk factor for heart health. Consuming excessive amounts of alcohol, especially at a time, negatively affects heart rhythm and blood pressure balance, paving the way for heart attacks and strokes. High blood pressure is another risk factor that causes cardiovascular diseases. It is emphasized that it would be useful to have their blood pressure measured from time to time, since almost half of the hypertension patients in the society are not aware of this condition. Because hypertension is one of the most important risk factors of coronary artery disease. Treating obesity, one of the important diseases of our age, and lowering blood fats, namely cholesterol and triglycerides, also reduce the risk of heart attack. An equally important risk factor is considered to be a sedentary lifestyle. It is necessary to exercise regularly and consciously against a sedentary life and to give up a lazy lifestyle. In short, cardiovascular diseases stand out as the most common cause of death in the modern world. In this regard, it is useful not only to be careful in cold weather, but also to be careful about risk factors that may cause a heart attack.